Namaste. How many of you here have used Uber? Wow, almost everyone. How many of you have gone to Netflix online? I don't believe this. How many of you ever ordered groceries online? What? So here it is. The point I'm trying to make is technology in the here and now has changed our lives. How many here used to have records and now listen to music online? Disrupted our lives completely. How many of you have stopped going to banks? Some of you are too young to even know what a bank is, but we used to have to go to banks. All this has been disrupted by technology and data in our lives, in our own lifetime. Yet, when it comes to public health and when it comes to health in the developing world, we are leaving this technology far behind. There is what I call a data inequity, a data divide. The class distinction of the future of those who have and those who don't have will be the ones who have access to data. Just as today, those who have access to money have better health, in the future, those who have access to data will have better health. And in that data inequity, the poor and the vulnerable are being left behind. Nobody's designing apps for them. Nobody's designing models for them. Nobody's designing systems for them. If they're lucky, what is being designed for the rich, developed world is being thrown across the fence. If they're lucky, there will be some of those that will reach them. But that's not how it is supposed to be. We should be building with that in mind, because we are only as strong here in our health as the weakest link is strong. And when Ebola happened or when Zika happened, that was proven that diseases happening in that side of the world have nothing to do with that is a fallacy, and that unless we build system and strengthen systems there, we are vulnerable here. So with that in mind, what Rockefeller Foundation is trying to do is have a hands-on approach to what we are calling data-driven community health. We believe that good health is in communities before sickness happens. Our current model is healthcare, hospitals, facilities, after somebody falls sick. So we wait till somebody falls sick, we tune them up, and we put them back in the environment that caused the problem. This is healthcare, this is health. We need to focus on health, not healthcare. But currently, all our focus is on healthcare. So at Rockefeller Foundation, we are instituting a program where we're trying to get real-time, data-driven community health insights that will help frontline healthcare workers do their jobs better. Bring to the masses in real time benefits of data and data-driven community health. And by doing so, we hope to strengthen systems that will eventually benefit all of us. So it's not a question of do we have the luxury? We are at a tipping point. There is so much data and there's so much disruption. All of you told us that in your own lives that your data has disrupted or has changed your life. We should do the same for communities that are struggling with health issues. And the only way to do that now, the only way to do that now is to harness the power of data and data science and serve it to the communities for better health for all. Yeah, thank you.
Thank you, Naveen, thank you.
I think I was ahead of time, but...
Sorry, am I cutting you off?
No.
I don't want to.
No, come on.
Yeah? Okay.
I think I was ahead of time, but I said my piece.
Have you finished your presentation? Because I would happily leave the stage. No?
You're too
Okay.
kind.
I think you can read my mind. I have one more question for you, and it is, how will you use your power?
How will I use my power? I will use my power to make the invisible visible. And to me, the invisible right now is the most vulnerable. And the most vulnerable is the underprivileged woman and her girl child. I will make them visible through data. And that's how I'll use my power.
Fantastic. Thank you so much. Such a pleasure. Thank you.
Thank you.